Sometimes the biggest emergency is not the one that's bleeding on the outside. It was one of my trauma duties. An ambulance rushed in with a woman who had been in a road traffic accident. She was not talking, she was not answering any questions. She just kept crying out again and again. Nothing we said seemed to reach her. For a moment, if you did not know better, you could have just thought she was terrified after the accident. But trauma teaches you something very early. When a patient stops making sense, don't ignore it. Find out why. Apart from the polytrauma that the patient had due to the RTA, she also had a not so significant wound on her head. We stabilized her, checked her vitals, put her on a cervical collar, put her on IV fluids, and then sent her for an NCCT investigation. I remember standing there impatiently waiting for the images to appear. Then there it was. A temporal lobe hemorrhage with an associated hematoma. So the patient had not been acting strangely. Her brain was injured. In matter of minutes, the entire focus of her care changed. She was managed according to trauma protocols, monitored closely for neurological deterioration, and the neurosurgery team was urgently involved for definitive management. Standing there as an intern, I realized something that no textbook had ever taught me. Patients don't always tell you what's wrong with them with their words. Sometimes strange symptoms are the only language they have left. And if we don't listen, we might miss the one thing that can save their life. Never dismiss confusion, disorientation, or strange behavior after a head injury. It may be the brain asking for help.